You might not know their names, but every day small charities provide a lifeline for people across the UK. 85% of charities across the UK are considered small, but they only receive 12% of the funding that goes to charities overall. We've teamed up with our official charity, Global's Make Some Noise, to champion these vital organisations for Small Charity Week. And today we're speaking to some representatives from some of those small charities in the mental health sector. We're joined by Dr. Shantanu Kundu and Benjamin May, co-founder of the Be Free campaign and the New Normal, respectively. And we also have Dr. Simon Offer, who is the Labour MP for Stroud and a leading GP. Welcome to you all. So I thought I would begin with you, Shantanu. Can you talk us through what your small charity does and why it came to be?
Yeah, so to give you some context to what we are, so Be Free Campaign is a young people's mental health charity, all about giving people the tools they need to look after their mental health. And where we sort of focus is around inequity. So we're based up in Liverpool, but half of our work is around delivery and supporting young people, but particularly from racialised and minoritized communities. And the other half of our work is national policy work, where we'll try and help shift policy and make things better. It came out of a sort of quite a dire need for my own mental health, where there's a massive lack of cultural competency within the mental health services and also within the NHS. And I can say that as a doctor, but I have seen firsthand how different care can be and how different it can be for young people from different communities. If you don't speak the same language, if you don't have the same cultural elements at home, but also the pressure and opinions of family members of mental health itself. So it came out of that as a real need, and now we deliver sort of services in Liverpool to those from racialised and minoritized communities, but also generally for those who are in impoverished communities. And we've seen the impact that's had since COVID. And so our job now is to see how we can shape policy and make things better from a government and law perspective that can help reduce waiting lists for the NHS, but also make sure that young people are at the heart of what we do, rather than sort of the last person to be thought of.
That's so interesting, and it's so important as well. I was reading a piece just under a year ago, actually, that was in The Lancet, and it was saying one of the reasons that young people's mental health is suffering in the way it is because nobody's listening to young people. So the fact that you are on the ground doing that from a grassroots perspective is amazing. Same question to you, Ben. Tell us a little bit about your charity.
So I was at work in my barber shop on Portobello Road in 2015 when a young man walked in and sat in my barber chair, and we began to chat, and we immediately connected over football, our working class background, music. And after about 20 minutes, this young man, Jack, told me that his dad, Dave, had actually passed away 2 years before. And it was a serendipitous moment because my dad, Steve, had only a week before been diagnosed with a brain tumour. And here we were, these two young men, now connecting over the most difficult thing that either of us had ever experienced. And over the months that came, Jack was someone who I went to every single time when I was experiencing difficult things with my dad. And when my dad died, Jack was the first person that I sat down and spoke to. And we were finding a space between us where we were just able to share and connect and speak about something that was so deeply important to each of us. And after a couple of years of us both being bereaved, Jack came to me and said, the community that he didn't have around him, he wanted to build, and that community looked like more people like us, more bereaved people. And so we decided to start a peer support group for bereaved adults. And since that first meeting in 2018, we've gone on to host 1,500 meetings to people from around the world who just come together to speak about grief, loss, bereavement, their experiences, and connect, and through that connection better understand themselves.
That's, again, such important work. We just a couple of weeks ago actually had a phone-in on the show about bereavement and grief and how it's still so taboo, even though it's something that every single person experiences in some shape or form. I wanted to begin by asking all of you a question, and we'll bring you in, Dr. Simon Offer, as on this first, I think. So some politicians have started to use this phrase overdiagnosis. We've heard it from Nigel Farage, but we've also heard it from Wes Streeting, from your party. And there doesn't really seem to be any evidence for that I can see, other than just more people are being diagnosed, but that doesn't mean that they're necessarily being diagnosed wrongly. And I wonder if I was to ask you the question, to what do you attribute the increasing number of people being diagnosed with mental health issues? What would your answer be to that?
So my response to this really is that I think over-diagnosis is the wrong word. I think the problem is that we've over-medicalised mental health. Now, I think that there are higher levels of mental health, and I think one of the factors actually was the pandemic, and that did sort of strange things to the population. It made us much more sort of neurotic about our health, and also the way that freedoms were curtailed were actually made it quite difficult, particularly for younger people. And we saw a real spike in all sorts of strange things, like eating disorders, for example, went up by a factor of 4 just after the pandemic. Mental health issues, again, were really predominant. So there's an element of that. I don't know about whether the internet and smartphones has much to do with it. There's not massive load of evidence, but inherently I feel that, weirdly, for a communication tool, it makes us more isolated. I think without doubt, social isolation is a massive issue in our current society. And I think if we can, I think there's some statistics around, if you're socially isolated, it's the same health risk as smoking 20 cigarettes a day. So, and that's, obviously an incredibly risky thing to do. So all those things sort of would certainly make mental health go up. And it certainly is going up. There's a real sort of pandemic of mental health at the moment, I would say.
It's interesting what you said about phones making us more isolated. I was reading, it was in George Monbiot's book, where he was saying how we're sort of oscillating between the knowledge of everything that's happening in the world on our smartphones, knowing far more than human beings have ever evolved to know. And then you put your phone down or you close your laptop and being completely alone. And so there's this isolation, but also knowing everything that's going on in the world. And the kind of halfway point between those two things is community. And that's what's so often missing, isn't it, from people's lives, which is why the work that both of you are doing is so, so important. Shan, what would your answer be as to why we're seeing an increase in mental health issues?
Yeah, so it's interesting because we're both obviously medical by background, Simon and I, but I'd probably take a bit of a different stance around we need to be clear around what we're talking about. So mental health itself is something we all have. It's like our physical health, it goes up and down. Mental health conditions are what we're talking about when we talk about overdiagnosis. So factually, from a medical perspective, there is an increased prevalence and diagnosis, but I personally wouldn't argue that it's an overdiagnosis, because there are factors, and I think one of the biggest factors you're probably missing here is poverty. And we have seen massive amounts of poverty increases for young people. We're seeing in some areas of the country, 40% of children and young people live in poverty. That is no doubt going to be a big factor in young people's mental health, but also taking into account racialised communities and the increase of racial rhetoric. The riots last year were the first charity in the country to launch our riot response hub that supported those who were at risk of being targeted, or who had been targeted and had been impacted by it. So I think what you've said already, completely agree with. Those are factors, but there is a lot more to the picture. But also from a diagnostic perspective, the evidence shows that overdiagnosis and the argument for overdiagnosis doesn't actually help the solution, because it needs to be around prevention, early intervention. And if you've had no service provision whatsoever for years, then of course it's going to be a massive increase in acute presentation of mental health conditions. There's no doubt with that.
I hard agree with all of that. And I also think it's really interesting that you mentioned the riots that happened last summer, because the news agenda has moved on, but the impact on really anybody who thought I could be targeted for the colour of my skin just for leaving the house, I think it still remains. I mean, the young people that you work with, how many of them mention the riots when they're talking about their mental health difficulties?
It's massive. And to give you some context, one of the young people that we support, they were saying to me the other day, actually, that they still are scared to leave the house. And that thought of safety isn't there anymore. But also the increase of just generalised racism has increased massively. So when I moved to Liverpool, it was actually quite diverse in terms of, I never felt that there were issues with racism. But more recently, I've had overt racism, both within the NHS settings, so from people who work in the NHS, but also from the communities as well. And so from my perspective, it's you can't forget about it, and it lives with us. But also when you correlate that to the charity space, they're the last ones to get the support. So we're seeing charities 3 times less likely to get funding if they are led by an ethnic minority person compared to those of white counterparts. So there is a big issue. And I think the whole crisis that we are seeing is not necessarily because of one particular issue, but a combination. But it means that those who are already, at a lower footing are worse. So that divide increases, I think.
So it's exacerbated a problem that already existed. What about you, Ben? What would your answer be? Or is there anything that you can add to what's already been said in terms of the increase in mental health diagnoses?
Yeah, I mean, it's hard to add too much to that, right? You were both so succinct and, kind of covered quite a lot of ground. I suppose community is the one thing that obviously, we're kind of focused on at the New Normal, like creating and developing that community and giving people a space where they feel less isolated, which, is something that was acknowledged. But then also just the conditions and the environment in which we expect people to exist these days. I mean, you can deliver services to people, but if they go home to, black mold all over their walls, if they're waking up early and getting home late and they've got food poverty, they're working all of the hours that you can imagine, and then they don't have the security around their basic needs. I don't understand how we think that there couldn't be an increase in mental health diagnosis in those conditions. And the poverty gap in this country is ever growing. More and more people are living in incredibly difficult circumstances. So why we are, trying to, I personally think, use this as a sound bite, and I don't agree with Wes Streeting. I certainly don't agree with Nigel Farage. I think that both of them are incredibly ignorant and completely undermining actually the needs of people. I think we have to be very, very realistic about the conditions in which we've created.
It's interesting, isn't it, when you see a spike in mental health diagnoses, you can go one of two ways. You can either go, why is this happening? Or you can say, well, no, everything's exactly the same as it was, so they must be making it up. Yeah. And it seems a lot of the politicians who are in positions of real power and influence are choosing to go in the latter direction, which is, as you say, really troubling. The other thing that's really troubling is the state of NHS services. There are 6 million people, the last time I checked, according to Mind, who are currently waiting for NHS mental health care. And that might explain why some research that we did showed that 1 in 2, or half is another way of saying that, half of people who have had to rely on small charities in order to get the support that they need. And it's wonderful that those small charities are there, but it's not a substitute for NHS care. And we've also heard stories of people being sent, hundreds of miles away from home in order to seek mental health care. I wonder, can you give us an insight, Dr. Ofer, into what the government is doing to address this?
Well, I think there's certainly a push to reduce mental health waiting lists, but I think actually some of the small charities, as we've seen on this panel, they're much more sort of embedded in the community, actually, the mental health services, which tend to be sort of done to people, whereas I think what you people are doing is actually developing sort of services with people with mental health difficulties. So there's an element of what they call co-production, which is really fantastic about the charitable sector. So although I would really, and I think the Labour government is really trying to get a much better mental health service, I wouldn't like it to be a state, completely state-run thing which is imposed from above. I think that so in my area, in Gloucestershire, for example, there we've got an organisation, a charity called Artlift, that's developed sort of creative therapies for children and adults, and that sort of thing is grown from small beginnings. I imagine like your charities. So although I think we need to make a massive improvement in mental health, I don't think we should ever exclude smaller charities. I think my feeling about it, and this is a very personal feeling rather than a government feeling, is that we need to actually fund charities to an extent to do the sort of work that they're doing. So like bereavement support is really important, and at the moment it's very poorly, I can't get bereavement support in my area for my patients very easily at all. So if you're doing it, we should fund you to do it, and rather than create a whole new state-run system, we should use what you're doing, and that's one of the beauties of mental health, actually, and I really enjoy working with the sector for that very reason.
So in the forthcoming review of the NHS, this huge document that keeps being delayed.
Yeah.
But one of the things that we're expecting to see is the government announcing that the GP surgeries and other NHS outlets are going to be working with local businesses to provide care. But do you think that we might see as well they'll be working with small charities within communities to provide that kind of holistic, isn't it? That's the word that we're grabbing.
Yeah. Well, they're talking about these neighbourhood health centres, and I think what they do is they incorporate what's happening in the area and try and pull it all together. And we've got a community centre again in the Dursley area where I work, which is called GL11, and it's fantastic. It's got loads of volunteers and doing really good things for people, and we need to get that as part of our business. So what you were saying about community is really important, and I think one of the strange things about being a GP is often the GP surgery is part of the community, and I think the idea is to, with that, sort of pull in lots of people support, and I'm quite excited by that. I think that's a really sort of good way to go, because I think there's a lot of good things happening in this country, and sometimes GPs aren't even aware of it, and we have things called social prescribers that can sort of link up. So it's all about building those networks, and actually it saves the NHS a load of money if we do this as well, and more importantly it gets people better, and even more importantly it prevents mental illness, and prevention is absolutely the gold standard. And I think that's what small charities do. They take so if you've been bereaved, you're at higher risk of developing a serious mental health issues, but if you intervene early, then you prevent that happening. So it's good, I think, in that way.
One of the things that I was really shocked at when I was looking at the statistics, only 12% of funding is going to small charities, despite them providing an estimated 85% of the support on the ground. And I'll come to you first on this, Ben. How difficult is it for you to get the funding that you need to provide the support that you provide?
Yes, it's incredibly difficult. It's incredibly difficult. I mean, we provide something close to 25 to 30 peer support groups every single month for people around the UK. And we do that with mainly a volunteer staff. So we have 2 people who work for us, myself and one other person. And it's really interesting listening to you speak, to think about how we actually do work towards funding organisations. I think for me, one of the things that I find really frustrating is to hear from Simon a really sensible way of kind of moving forward with supporting small charities into providing local services and care, but there is no joined up thinking. Why are we looking at businesses? Why are we going to empower businesses more? Why are we going to give businesses more money? When actually what we should do is we should focus on supporting small charities, focus on diverting money away from the big organisations, which ultimately are just keeping the lights on at this point. If you look at a number of these organisations, they're not delivering services, they are just surviving. If we were to defund them and put that funding into places where it really matters, actually we could transform the NHS, we could transform waiting lists, and we could transform the health of this country. So that instead of worrying about over prescribing, we actually look at care and we look at how we support the people who need support the most.
And something I've noticed as well, and I don't know if you would agree with this, Shan, is that some of the big mental health charities still seem stuck in their awareness phase. And we've been doing the awareness thing on mental health since, I'm going to say, about 2009 in this country. We're aware, what we need now is some action. And I wonder, what are your reflections on how difficult it is for a small charity to do that action?
Yeah, so I think I'll sort of come on a few points. So the first one around social prescribing. So social prescribing, great idea in principle. When it comes to actually delivery, all the money goes to the people giving out, sending people and signposting, but none of the money goes to the charities supporting them.
Okay. And
that's a big problem, because we then lead to an ecosystem where we're funding, people diverting places, but actually that's not where the money should be going. It should be that community-led approach. Around mental health awareness. So for me, this is a big passion. I obviously struggled a lot with my mental health when I was younger, but awareness has increased massively, but that's in the general population. If we take cultural and racial elements of it, there is still a lack of understanding. When it comes to big charities, completely agree. There is that older school approach to it. But also, once you get above a certain size, it becomes harder to innovate and harder to be grounded in the communities. So I'm a big believer in charity should not be a cheap substitute for government services. It should be well funded, but to a point where it's actually self-sustainable for the charity. So if that money were to go, the charity is not necessarily struggling. And that's why I think micro-funding charities within the community, that means a diverse approach, but also making sure that charities aren't exceeding $1 million in turnover, and actually we're retaining that innovation, that drive for support. And that's where I'm very lucky that I can run a charity that I don't want to be earning, turning over £20 million a year. That's not what we want to do. Our sweet spot is that £200,000 to £500,000 turnover, where you can actually make sure every single penny is used to support the people we serve. And I think that's really important. We serve these people. We're not here in it for the money. I don't take a salary from the charity. I'm very lucky that my NHS job pays me well to be able to do some part-time work in the NHS, but also in the charity sector. But that also doesn't mean that the service that we're providing in the charity sector is at all subpar. And so as we go forward, I think funding for charities needs to be more diverse, but also not just reliant on philanthropy, but taken from multiple different pools. And I think that's where we're going to hopefully see things move. But I'm yet to see that happen.
And I'm really interested in the work that you're doing with racialised communities, because I was at a conference the other week where there was actually a GP there who used the phrase, she said it's difficult to help people from certain backgrounds because, well, it's a cultural thing. And there was a woman there who was from an African background who stood up and said, I don't think you understand when you say that. Yes, it is a cultural thing, but why is it a cultural thing? Every interaction my family have had with mental health services or health services in the past, the law has been involved. So when I was a kid, I thought if I told my GP that I was struggling, my dad would go to prison. Yeah, and you don't seem to understand that. I mean, what would you like GPs to know more in terms of what are the barriers to racialised people from seeking help?
Yeah, I think that the first step is that everyone calls people hard to reach, but actually they're easy to forget, right? They're the first people that we forget about when it comes to support. We need to move towards a system where it's actually, how can we make the doors open, but also how do we stop waiting for people to come to us? It's going out into the community and actually supporting them where they are, but also mirroring. I think we need to recruit more therapists and psychologists and doctors from backgrounds and communities that we represent. And it's very rare to see that actually occur. I think doctors are getting better, but there's a lot of politics around it. Within nursing staff, it's getting better. Again, lots of politics. But within psychology, we've got still a very low recruitment level of therapy. The criminal justice system, as you mentioned, is really important. So 40% of those who are from ethnic minority and racialised communities will access mental health services through the criminal justice system. That's a massive amount. And so we need to be working with the community to say, how do we, rather than say, okay, if you're a black young person, you're 4 times more likely to be sectioned under the Mental Health Act. How do we spin it and say, how can we support you earlier? But not necessarily say, yes, we're going to wait for you to come to us, but actually work with people and actually deliver the services where they are.
That's another interesting thing, because you've all mentioned prevention. I wonder, Ben, what do you think could be done, bearing in mind we all go through bereavement, as I said, at some point in our lives, to prepare people better for that experience?
I mean, one of the things we could do is maybe talk about it.
Yeah.
We simply don't talk about bereavement. You know, for the majority of us, we kind of have this anticipated timeline that someone will die, and then after the funeral, we'll just carry on with our lives as they were before. One of the biggest things for me, my dad was my best friend when I was young. And when my dad died, that was, the closest person to me was gone. What a huge shift in my life. And to just think that after he was, buried, that I would go back to normal, to me, it seems reductive to the relationship that I had. So being honest about what we can expect from grief, from loss, I think is one of the fundamental things. But also as well, bringing these conversations away from, support groups and bringing them into to the general population. I mean, why do we have to hide in a room to talk about how we feel? Why can we not be able to share that openly, publicly, with people, with friends, with colleagues, with communities? We need to be taking these conversations away from, quiet spaces and bringing them into the general discourse so that people actually genuinely understand how people are feeling and what they're experiencing, so that when they then go through that as well, they have some relative points. And I think this goes across everything. we are so scared. I mean, we talk about highlighting these things. We talk about, awareness. But what are we making people aware of? Are we actually making people aware of the struggles that people experience when they're going through something, or are we just talking about something? Are we saying, "Oh, depression is something," bereavement is something? Or are we talking about what those things are, so that people can cognitively understand exactly what it is that somebody else might be going through? For me, perspective is everything. Perspective helps create that depth of empathy that we need to create a better world.
And I guess the more people's stories you hear, the more you can go, well, it looks different on different people, but I really relate to what that person said.
Yeah.
So I'm going to challenge you all now. You only have about 30 seconds to a minute to answer this question each. If you could wave a magic wand, so when I'm not behind the mic at LBC, I work in education. So I often say, if I could wave a magic wand, I am redesigning the national curriculum and putting mental health at the heart of it. That's what I would do to make the world a better place in terms of mental health. I'm going to come to you first, Dr. Ofer. No pressure. What would you do if you were king of everything?
In terms of mental health?
Yes.
All right, that's good, really good question. I think what we need to do is we need to get mental health services much closer to patients or people, and I think at the moment they're far too divorced from that, and so I think we need to start getting mental health workers in surgeries. I think we need to incorporate charities in surgeries, and we need to reduce the waiting list down to virtually nothing, because if we don't do that, what happens is doctors give out pills for stuff which they don't need to. So it's about, for me, getting services really close to patients, and that's probably in their communities and having no waiting list.
Shan?
Yeah, so I echo that, and I think the other side of that, from the acute side, is also the prevention side. It's investing in the community elements of it, but also making sure we can make it equitable. If you're living in poverty, you've got access to your Maslow's hierarchy of needs. You've got those basic things met. That means you can start to look at your mental health and how to help yourself, but also giving people the tools they need to look after their own mental health. That's going to be key. It's not about doing things to people. It's about empowering people to have that autonomy, that understanding of what they're going through, and actually giving them the respect and understanding of saying, do you know when and how to get help? And if so, we're here, and this is how you can do so. And it's really listening to the community. So I'd echo what you're saying and add on a bit there.
And Ben?
Yeah, really good answers. Thank you for stealing most of what I would have liked to have said. I think education is key. One of the big things for me, if I look at the people around me that I grew up around coming from working class backgrounds, I would say that a significant number of people don't understand mental health. They don't understand their own well-being. And so education for those people, I think, is key to understand exactly what they're experiencing and why they're experiencing it. And that goes across working class people, middle class, upper class people, whoever it is, to understand their experiences. Once we do that, and once we also give people the kind of role models that they deserve as well, people who are comfortable to stand up and speak about their experiences and tell their stories, then I think that we can start to move towards a place where conversations can happen openly, community can develop from that, and actually, if we pull funding in towards small charities, then we have an environment where people can really thrive.
LBC's charity Make Some Noise is championing projects like these, the Be Free campaign and the New Normal, who we've heard from today, through Small Charity Week. This week only, every £1 you give will be doubled thanks to support from players of the People's Postcode Lottery. So if you can give £10, for example, you will make an even bigger difference in communities across the UK. Visit makesomenoise.com to find out more about the charities taking part in Small Charity Week.